Okay, welcome to the video. You will notice that I've renamed the name of my channel, The English Native, and I'm going to be using that on Twitter and on Facebook, on Pinterest, on my website, theenglishnative.com, so you can take a look at all my materials there. The reason I've changed these names is I'm not just going to be doing examinations. I'm going to be doing quite a lot of different things. I'm moving into podcasting and other topics, areas, etc. So, what we've got here today, I've got a few letters, maybe 6 or 7, from my Telegram group, Prepare OET. So we're going to take a look at those. Let me just move that out of the way a little bit. Okay. And we'll take a look at these. I'm not going to give full assessments because that's what I do with my, premium assessment service. But we'll take a look and we'll have a look at the criteria, and I'll mention any points which I think needs to be mentioned, essentially. So let me get the changes now. I'm not going to look at the case notes for these particular letters in case of copyright issues. What I will do, probably later this week, I'll download some particular case notes from the official OET website, and we will use those, and I can compare and show you everything and compare it to the criteria, etc. So, first things first, I'm writing to request urgent management. Well, we usually want you to manage urgent management of, because you can't really use for, Mr Romano. Okay. 45-year-old insurance clerk who has been demonstrating features of acute myocardial infarction. Okay. When did Mr Romano present to you? Now, time references are important. They help to provide a cohesion and a coherence, a logical structure to your letter and writing. So, initially, on the 20th of the 18th, blah, 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 last Tuesday, we need some reference of time to, make this logical progression. So, Mr. Romano presented to me when? So, I don't know if this is today's visit, urgent, and you're going to talk about some past visits, or I've got no idea. So, that's not a very good start. So, we need time. So, when did he present with a complaint? Or I would put a definite article because it's a particular complaint now. The complaint of, it's something of something else. With the complaint of retrosternal crushing chest pain for 1 hour. He was a sweaty. Well, a sweaty is an adjective, so if you put an article, that implies it should be a noun. So I would take the article out. And that's a very short sentence. Upon, 1 word. Not 2 prepositions. Upon examination, a few crepitation or crepitations. Was heard, so were heard. At the base, article use, of the lung, with high blood pressure of 160/100. But what's that got to do with crepitation? So upon examinations, some crepitations were heard with high. Well, there is no with. It cannot be with. So you'd have to make that a separate clause. Well, and also he had high. He had high blood pressure, etc. So that doesn't work. ECG was relieved. Is that supposed to be relieve as in relieving pain? I've no idea. It's a very short sentence. ECG. What ECG? You haven't mentioned that you gave him one. And we need a definite article. Or is it an ECG was carried out, or he had an ECG, the ECG? So that sentence is not very good. Far too short. There's no articles. relieved. I'm not really sure what that means. Therefore, oxygen and angiodyne sublingually were commenced. Well, okay, get rid of that. And morphine, that's given intravenously. Well, you're not spelled that right either. In the meantime, I called an ambulance and sent Mr. Romano to your emergency department. Okay, regarding Mr. Romano's medical history, well, except it's not. It's social. He is a heavy smoker. 1 packet of cigarettes per day. I have to say, there's a lot of very basic English grammatical and vocab errors in this. I would be thinking about working on those before whoever wrote this thinks about taking the OET test. Overweight's one word. Mr. Romano has seen me on several occasions in the past few weeks. During that time, he's had high blood pressure reading. What is it? Is it high blood pressure readings? If it's an abstract noun, which was reviewed for 1 month. What was for high blood pressure readings? Well, that doesn't make sense. I have no idea what you're talking about. Then assessment as hypertensive patient. I have no idea what that means. It's not complete sentence. What was reviewed? Then what? Assessment. It's a noun. So what? Should it be a verb? He was assessed. I assessed him. I have no idea. That's not very good English. Nifedipine was commenced as. What do you mean at? Or I commenced him on. What's this? 2 tablets a day. I advised him to cease smoking. You don't say cease, you say stop. Cease your smoking, Mr. Dean. No, stop. That's what people say. You don't say cease. And reducing weight was recommended. Reducing his weight, presumably. And why do you have active and passive? I advised him, and reducing weight was recommended. Why don't you simply make both phrases active? And I advised him to stop smoking and to try and lose some weight. Isn't that more natural, how you would say? In light of the above, or in view of the above, Mr. Romano needs an assessment, and it would be appreciated if you manage him accordingly. So, well, what can we say about this one? The main thing here, language features, inaccuracies, many inaccuracies, far too many, in fact. So, purpose, okay, not too bad. Content, I haven't looked at the case notes. The main thing here is the, right, so for at least a B, you need 2 out of 3 for purpose and at least 5 for everything else. If you get less than 5 in one of these, you're going to be getting C+. And I could say here, inaccuracies in language, they do cause minor strain for the reader. So that would need a bit of attention, I think. Okay, see what we've got next. I'm writing to request your further. Oh yes, now one thing. We don't need a period after Mr, Mrs or Ms. You don't need it. It's only if it's an abbreviation, such as Doctor or Admiral. Everybody will tell you this. I'm writing to request your further evaluation of Mrs. Mario, who's presenting with signs and symptoms. Okay. Let's just check something, because this looks a little bit short. 167, I thought so. A little bit short. Upon today's visit, Mrs. Mario presented to me, to whom else would she present herself? Complaining of pain in the side of both breasts, along with the breast lumps. Well, why would you use a definite article when you've not introduced breast lumps yet? Along with what? Breast lumps. So, based on that, a provisional. So, some woman comes into you and says, "Oh, doctor, I've got pain in my tits," and you say, "Oh, you must have breast cancer." I think this is a little bit short. Now, usually when you're writing about a visit, you need 3 factors. What they came with, what they said, what you found, what you did. That's what you need for a visit. If you think about it, the patient comes, they say, doctor, I have blah, blah, blah. You take a look, then you take some kind of action. So that's what really you need to have for a visit. What they said, what they presented with, what you found, what you did. So that's a little bit short. Regarding Mrs. Mario's social medical history, she is a smoker, okay, peptic ulcer, which is under control or which is controlled by medication. Her mother has history of cancer, oh, okay. A cyst, okay. Dust and vinegar. Okay, her medication includes sleeping pills, okay, possibly relevant, as well as her body weight was 60 kilograms, seems like kind of tacked on. This whole paragraph here, essentially, it's a list. It looks like you've gone through the case notes and just gone tick, 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 list. I'm sure that not all those would be pertinent, and you have to draw some connection. Don't simply write a list. In light of the above, I would be grateful if you could take over Mrs. Mario's case and proceed as you deem appropriate. Okay, blah, blah, blah. So, too short. Not enough detail, not enough information. Signs and symptoms suggestive of breast cancer. Hello, doctor. I've got pain in my tits. Oh, you must have cancer. No. What did you do? Were there some tests? You must have had results. And what I mean, again, I don't have a case notes here, but as I keep saying, if you write your letter correctly, the reader shouldn't need case notes to refer to. It should be clear. So, what about this one? Well, let's have a look. Purpose apparent. Content from case notes. I'm sure there's something. Okay. Some key information. I'm sure there's something is missing there because that's far too short. I'm sure there's something missing. Some irrelevant information. Vinegar and dust. Writing's not too bad. Okay. Organization could be. It's not too bad. Inaccuracies in language, not too bad. But the main thing here is, where's the content? There's no content. There's something missing. There's some irrelevant. So, again, to get a B, you need 2 for purpose, and you need at least 5 in everything else. That's it. If you don't, even if it's just in 1, you're going to be getting C+. So, let's continue and see what else we've got. So that's a bit short. Mrs. Clark, 54-year-old patient, don't need the years. Was features suggestive of bronchogenic carcinoma. Okay. Mrs. Clark, working as office clerk, what? Working as what? Has been working. She is an office clerk. That doesn't make sense for some grammatical. It's not grammatically complete. What? She's currently. So why is it present continuous? She's working as an office clerk now. She has been, or she is. Has been smoking 35 cigarettes in a day or a day. 30 years, family history. Okay, I keep seeing this one. The father died of coal mining related, so it was emphysema or something similar, breathing in dust from the mine. So I don't think that's strictly pertinent because it's not hereditary. Initially, she presented with complaints of sore throat, or a sore throat, because you can count it, body pain, fever and cough, and a cough. That, which was treated, make it relative pronoun, with augmenting. Today's visit, she complained of dry cough, articles, which lasted, so what? It stopped, it's finished? Well, no, so why is it? It's simple past, which has lasted, so it's ongoing, make it present perfect. For 7 weeks, associated with breathlessness that worsened at night, demonstrations of illness in the chest. Except what? Except for that, she performed routine works. Routine works? What do you mean? Routine household tasks? Is that what you mean? Without any assistance, any difficulty in doing exercise? Well, who said that she did? Where's that come from? On examination of systematic abnormalities were noticed, consolidation with monophonic wheeze around the chest, therefore an X-ray and CT scan were arranged that showed further investigation, such as further assessment and investigation. Well, people keep using this, but in terms of English, investigations, I mean, you're not a detective, really, you know, so further assessment and tests, such as a bronchoscopy, however you say it, that can be counted, yeah? Bronchoscopy and biopsy, and a biopsy, as needed to confirm a diagnosis, were discussed with her. Why is this broken up into 3 separate clauses? Further possible tests were discussed, such as a bronchoscopy and a biopsy to confirm the diagnosis. You could simplify that sentence. One thing, the criteria, the examiners say they like it concise. You know, in view of the above, has been suffering. What? She's not suffering now. She is. Has been. Why is it present perfect continuous? From lung cancer, because usually when you're using present perfect continuous, you use adverbs for and since. You know, for 2 years or since 2017. Your expert advice, well, we would imagine he's an expert, so you don't really need to lick his ass. Your advice and further necessary action would be highly appreciated. By whom would it be appreciated? Presumably by Mrs. Clark. You don't need to do this. Why do people keep using these adverbs? Highly appreciated. Medical professionals do their job. It's what they do. It's what they get paid to do. You know, you don't have to highly appreciate anything. So, let's have a look. It's not too bad. Not too bad. Purpose apparent. Okay, I would probably, yeah, I think that should be okay for the solid B, I think. It's not too bad. Not too bad. Okay, I'm writing to Toby, who is recovering from gastric reflux disease, and mother Mrs. Phillip, who is depressed due to undergoing difficulty in breastfeeding a baby. Your further monitoring and support are required to improve their condition. So, okay. Now, purpose. So you want the reader to further monitor and support them. So I've attempted to be as concise as possible. I'm writing to request your further monitoring and support of baby Toby, his mother, who is recovering from GORD and depression, respectively, or something such as that. Right? Just have it a single sentence, and then you, throughout the letter, you expand on that purpose and you restate it at the bottom before the conclusion. Okay. Toby was born under our facility? Under? You mean he was born in? Through, or by, or via emergency LSCS. 30th of October 2019. At that time his weight was, why is that capital? And APGAR score, his APGAR score was low. 4, what? At 4. Toby has exhibited signs of increased gastric reflux, which impacted on his feeding. Due to this, Miss Phillip becomes what she. Why is it present simple? Miss Phillip has become discouraged. Make it present perfect, as she was unable. His baby. She was unable to feed her baby. Consequently, what? As a consequence of what? Now, it's not Consequently, it's subsequently or following. Consequently means as a direct result or consequence of something else. I punch you in the face. Consequently, it hurts. You lose teeth. No consequence here. Possibly following or subsequently, yes, but consequently, no. And Toby didn't reduce his weight. How did he do that? Did baby Toby decide to go on a diet? Did he stop eating carbs? No. So he didn't reduce his weight. He lost some weight, maybe, but he didn't reduce his weight. Toby lost weight. Well, it's not a consequence, is it? So I don't really know what you're trying to say here. Lost some weight from 3.8 to 1 kilos. Therefore, Miss Phillip was advised to commence. So who advised her? Well, if it's a facility, if it's a hospital, then okay, we can use the passive voice if we don't know who performed the action. Was advised to commence on supplementary bottle feed, which needs to continue after discharge. Okay. Today, Toby was brought to the emergency room with complaints of vomiting and increased. Well, he wasn't really complaining though, so was brought to emergency as he was vomiting and had increased gastric reflux. And Miss Phillip also expressed a feeling of pain. Oh, I have a feeling of pain. Well, she wouldn't probably say that. Miss Phillip reported feeling pain during feeding, as well as on wound area. Where does it say Miss Phillip has a wound? Where does it say anything about a wound? It doesn't, that I can see. Okay, on the examination, Toby was healthy. Why was noted as healthy? He was simply healthy. Miss Phillip was diagnosed with breast nipple infection and was commenced. Why is this a separate sentence? And she was commenced on. That should be. Get rid of that period. Okay. Her incision wound. What incision wound? What? Where does it say anything here about a wound? So you're introducing things here that you've not previously mentioned. So the reader, as I am now, is basically going, wound? What wound are they talking about? I can't see a wound. So, in view of the above, greatly appreciated. Why would it be greatly? Simply appreciated. You could monitor Miss Phillip's feeding pattern, if that's genitive case, possessive Miss Phillip's feeding pattern. And baby's growth and development every week. Kind of advice regarding the techniques of breastfeeding, or simply, why not say breastfeeding techniques? Why would you say the techniques of breastfeeding? Why would you say that? Breastfeeding techniques. Oops. To avoid heavy lifting weights. What you mean to avoid lifting? Where exactly does it say anything about she's in the habit of lifting heavy weights? So again, you've dropped some information in here, and the reader is kind of puzzled. Where did it mention this? Is she a bodybuilder? Does she go down to the gym? And what are you talking about? Vigorous exercise for 6 weeks. Okay. Well, okay. Purpose, not too bad. Language features. There's some information here. You've dropped in bits of things. There's no connection. I'm not sure what that is. So you need at least 5. You need at least 2, and everything else must be 5. Even if you've just got 1 less, you're going to be going down. So I think there's some information possibly missing there. There's certainly some things that have been dropped in without any explanation. And we've got some grammar here, language features, minor slip. They generally don't interfere with the meaning, not really. But the content, not as clear as it could be, shall we say. Okay, what else have we got? How many more? We've got a couple more here. Okay, I'm writing to refer Miss Tabitha. Well, if you've got the age here, you don't need to have it here. And who cares if she is single, and if it's Miss or Ms, we can kind of guess that. Okay. Something we're talking about diabetes with non-compliance. Now, I thought we weren't supposed to be using this because it's judgmental. I thought the council say we shouldn't be using this. We can't say non-compliant because it's judgmental. We cannot use it. So we're supposed to be using things like non-adherent, as far as I understand. To insulin, what? To her, thee, we need a pronoun or an article. To her insulin regimen. But, and then we've got my favourite nonsensical sentence. What does this mean? And therefore, why therefore? Why is that a direct consequence? And why highly? Why is it always highly? Right, if anybody can show me a sample from OET where this sentence can be found, I'll give you a prize. Because you won't. And there's a reason why you won't. Okay, in terms of medical history, what? In terms of her medical history, you mean? Miss Tablin has been suffering from type 1 for 38 years. Non-compliance. Right. Non-compliance is a noun in general terms. You mean non-compliant as an adjective. But here, we're not using it. We're using non-adherent to her medications. Because comply, obey, is judgmental. So we're not supposed to say that. Okay. Note, please. You mean please note? She has hypertension too. That's kind of a short add-on sentence. Why? Oh, and please note she's hyper. That doesn't work. No, you would have to put that somewhere else. Somebody talking about diabetes and has hypertension. Also, she has a history of. So I would probably put this somewhere there. Okay, instead of an add-on sentence, which doesn't make sense. Today, Miss Tabelin was seen at my clinic as a follow-up from hospital admissions. She has, I suppose that should be a she. She has a history, multiple prior hospitalizations for the same issues. Article use. Educated. You mean she's been told? She's not been educated. That's not the same thing. Multiple times, diabetes communication cessation. You need to ignore these medication. Well, she didn't ignore her medication. She ignored these recommendations, I suppose, or she ignored your advice. Highly appreciated. Why would it be highly appreciated? If you could evaluate her regarding glycemic control, I'm going to she needs a higher level of care or higher levels of care. Right, articles. So, okay. Looks a little bit short. Let's have a look. Looks a little bit bare. 192. Do you think it has all the information in here that we need? I think there's something possibly missing here. It doesn't seem to quite fill out the general picture. I don't think it quite fills out that picture. Really, we'll have to check the case notes and have a look another time. Right, I've just got two more, then I'm going to call it quits for the day. I've got something else on in a bit. Mr. David, 45-year-old man, features are suggested. Oh, not this again. Your further assessment management, highly appreciated. Yeah. Nonsensical sentence. Regarding his past medical history, he has occasional low back pain, which he takes anti-inflammatory meds. Okay, osteoarthritis, and yeah, I would spell out your abbreviations. Uncontrolled by some medications. Today, his pain was uncontrolled with medications. Well, that's kind of strange. What? So, what does this mean? So, his pain was uncontrolled with medications, or uncontrolled by, because presumably it's an agent, so it's passive, so it should be uncontrolled by medications. But so, is this his occasional low back pain that you're talking about? Presumably. So he's got occasional low, so features are suggestive of nerve root. Okay, past medical history, occasional back pain. Today his pain. So is this because here it says occasional? I suppose it's lower back pain. So is this severe pain? Is it intense pain, or is it just a mild achy pain? I've got no idea. Today his pain, presumably his back pain, was uncontrolled. So you would probably say his medications have ceased to be effective, or today, Mr. David, if that's, I don't know if that's his Christian name. I think usually David's a Christian name. It's not a family name. Today, Mr. David presented complaining that his back pain was no longer relieved by his medications. Also, his lower left leg had become numb. Okay, that makes a bit more sense. His SLR test was 10 degrees, and respectively, additionally, his random blood sugar has increased. Okay. So, I'm curious. So, we have this visit today, and then we've got an initial visit and a subsequent visit. Now, surely, this would have made more sense to do a chronology. So Mr. David features blah, blah, blah. Okay, regarding his past history, he has occasional back pain, blah, 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 blah. So he came in initially on the 12th, sudden severe low back pain, which radiated, presumably it wasn't radiating in the examination room, radiated towards the back of the left thigh or his left thigh. We need a pronoun or an article. The pain was so severe that it restricted his lumbar flexion and extension. His SLR test was positive on the left side. Plenty of missing articles here. Therefore, he was prescribed paracetamol drugs. Subsequent visit, okay. The next visit, no improvement of his previous symptoms. Consequently, the doses were increased. They weren't enhanced. They were increased. 2 days later, his pain leg got worsened. His leg pain had worsened or had got worse. Probably had worsened is better. Difficulties in walking. How do you walk with an SLR test? You mean he had difficulties in walking, comma, or semicolon, separate issue. Also, he had a reduced SLR test. Don't join them up. In addition, his random blood sugar was 10, blah, blah, blah. Hence, he was advised for. Well, he was advised on or advised about. Well, he was advised to make dietary medication. So, surely, this would have made more sense if you'd have done a simple chronology. He came in, visit, and today he came in as a consequence of the visit. Today, my diagnosis is nerve root compression. Where do you say anything about this prolapse or nerve root? So, look, you've got nerve root compression and disc prolapse. So, where do you say anything about that here? Oh, hence I advised him to change his diet. Where's it? It doesn't say anything about that. So where's that come from? You've got to spell things out. Okay. So I would have done this as a chronology, because that would have made more sense to this particular one. I would have done it like that, and I would have spelled out, in view of the above, in light of the above, my provisional diagnosis. So you should have put that here. In view of the above, my provisional diagnosis is nerve root compression and prolapse. So I would like you to do blah 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 blah. That's how I would do that letter, particular one. So the purpose apparent, but it's not sufficiently expanded. Not really. We need to restate it at the end. Organization, not always logical. It's not. Why is it not? Why is it, today and then he came and here and there? Do it as a chronology for this particular letter. That would be fine. So purpose, okay, not too bad. Some language features that don't really interfere. Length's not too bad. Content could be a little bit spelled out a little better. And the paragraphing could be a little better too, I think. So I would think, probably C+ for that one, for those two reasons. And very quickly, I'm going to finish this one, because then I've got to go. Refer Riley. Did Riley present himself? No. So presented is probably not the best word. And again, we've got this. What does this mean? Your further assessment and management would be appreciated. What do you want me to do? Why would it be appreciated? I'm writing to refer Riley who? Well, he didn't present anything. So whose signs and symptoms are is better. So look, right, you can take this out and make it possessive. Whose signs and symptoms are suggestive of. Okay. Riley presented irritable. How can you present irritable? I'm curious. How can you do that? How can you present irritable? You can be irritable. Presented, a verb, you need an adverb. So presented irritably. And how can you do that? So in terms of verb, adjective, adverb, that doesn't make any sense. With associated sore throat and husky voice. His examination revealed the temperature. A tender article, as was made as comments on. Okay. Well, he didn't present. He's a kid. Somebody brings him in. Associated 4 days history or 4-day history of passage of dark brown urine. Very short sentence. Euro analysis revealed microscopic hematuria. You counselled a 4-year-old to ensure adequate hydration. Are you sure? Don't think so. I don't think so. But that's how it reads. He was counselled. Hello, Mr. 4-year-old child. I counsel you to make sure your hydration is adequate. No. I shouldn't have to tell you what's wrong with that. Right, presented persistent symptoms with blood pressure, not seen, okay. Well, what do you think? Some inaccuracies in content, maybe. Not too bad, but you're writing as if Riley is an adult, and he's obviously not. So I just take a look at that. Okay, so not too bad. Right, well, that's me done for today. I've got some students coming in a bit, so I have to take care of them because they pay me, and you don't. So, though, if you wish, you can support me on Patreon. The link is in Telegram and below here, if you wish. So, that will do for today. I hope that's useful. I might make another video later in the week if there's some more letters. We'll see, as always, on time, how much time I have. Okay, I'll see you later. Bye for now.